Good afternoon. This is Dr. James Marion being recorded during a live broadcast of our third Thursday from the Susan and Leonard Feinstein Inflammatory Bowel Disease Center here at Mount Sinai Medical Center in New York City in the United States. I'd like to welcome two particularly valued and special guests who have been guests on this show in the past, Dr. Robert Hurton and Dr. Maia Kayal. These are assistant professors here in our Division of Gastroenterology, both superstars in IBD, but now are wearing slightly different hats. They are co-directors for our upcoming 18th annual Mount Sinai Inflammatory Bowel Disease Consultants course, Clinical Updates and Practical Strategies, which is going to be held this Saturday, November 20th, between 8 a.m. and 2:30 p.m. Eastern Standard Time. This is our 18th annual course. We're doing it virtually, and the most important fact that I want to point out to our audience is that it's free. It's absolutely free of charge. If you have a link, you can come in and listen. It is open to anybody who has a link at this point. If you're a medical professional, nurse, PA, physician, you can claim credit for continuing medical education, but otherwise it may be of interest. And I have these two special guest co-directors and colleagues today here to discuss some of the highlights of this ongoing course. So this has been going on for about 18 years, and I think I was not even half joking that both of you were probably in middle school when we started doing this course. But Rob, I have a question for you. Talked a bit about who's participating. What is the main topic and what is the goal of this course? What are we hoping to accomplish this Saturday for our audience?
Yeah, that's a great question. So there are a number of different inflammatory bowel disease courses throughout the country, put on by great centers all over the region, throughout the nation, even the world. One thing we wanted to focus on this year was really practical managements of IBD. We really wanted to boil down some of the literature, some of the new advancements in inflammatory bowel disease, and really say, how can we translate this to the care of our patients in a real practical sense? How can doctors take this from sort of the textbooks and the medical journals and boil it down to, the exam room where they're seeing patients with inflammatory bowel disease, and how can they apply these new techniques and technologies to those interactions and to those patients to get them better.
This is great. So it's not just going to be a scientific lecture on basic science, what's going on at the bench, all of which is important and all of which we participate in. But it sounds like it's going to bring everybody up to date, but also bring it to sort of a real practical, sort of in practical terms, how to bring this into your own practice and how to think about it with your patients. That's great. So Maia, I guess for you, I'm wondering if you could fill us in a little bit on what the new updates, what the new kids on the block are going to be when we're talking about this going forward. Lots of new names that are out there, right?
Yes, you're right, Dr. Marion. There's a lot of new medications that we're super excited about that are in the pipeline and soon to stage in 2022, and some already come out. So Dr. Bruce Sands, the chief of our division, is going to be giving an amazing talk entitled Adequately, the New Kids on the Block, with a focus on ozanimod, risankizumab, and upadacitinib. Ozanimod, as you know, is already approved this year for ulcerative colitis, and risankizumab and upadacitinib, we're hopeful will be approved in 2022. And these three medications are revolutionizing the way that we're managing IBD. But there's a lot of questions about where we're positioning these medications, how are they practically used in the office, how are we actually getting them from the pharmacy to the patient's hands? So Dr. Sands will be giving us a great update on how, again, practically to use these medications in the clinic and what we can expect from these medications in terms of efficacy and safety profiles. So we're very excited about that talk.
And so, again, I know that you were actually going to be talking more about treat to target yourself. So I'm going to ask you to tell me, so we're going to have these new kids on the block, but what are you going to be telling us about treating to target?
So, 2020 was a very exciting year because the International Organization of IBD came out with updates to our treatment targets that we, very regularly apply in IBD. And treat to target is really a change from our traditional management of IBD, where we were very much focused on symptom management, escalation of therapy according to symptoms, but we've really kind of become more objective in our treatment selection and escalation. And so what I'm going to be focusing on this year in the IBD course is the updates in our treat to target and how we're not only using new targets, but also new methods of assessment in our patients with IBD. So we're going to be talking about the STRIDE recommendations and their updates, but we're also going to be teasing a little bit about the use of intestinal ultrasound in the clinic and how we can be incorporating that into our targets, also transmural healing and histologic healing. So it's going to be a great talk with recommendation updates from 2020, but then also bringing in some of the novel assessments and targets as well.
That sounds terrific, Maya. I really look forward to hearing your talk. And Rob, I know you're going to be discussing, I think, the most difficult moving target that we all have to deal with when we're treating our patients with inflammatory bowel disease, when there's an overlay of irritable bowel syndrome. So again, the symptoms getting in the way of our ability to know whether or not we're helping our patients. So give us a bit of a preview of what you're going to be covering.
One of the things we know in inflammatory bowel disease is that there's sometimes a discordance between inflammation and symptoms. So we'll see where people's inflammatory bowel disease is getting under very good control. We're healing the inflammation, we're getting their intestinal tract back to looking like normal, but we still are seeing people who are experiencing symptoms, whether it's abdominal pain or diarrhea. And this can be very challenging. It really can impact people's quality of lives. It really affects the patient and all their interactions in life. And it could be a challenge for the inflammatory bowel disease doctors that they're seeing to figure out the causes of these symptoms and figuring out ways to be able to get people to feel better so they can go back to living their everyday life, not having to think about having bowel movements or having stomach pains. So we're going to talk about the spectrum of all the conditions that can cause ongoing symptoms when your inflammation is better, and the ways that it could be managed and approached, again, to really translate in a practical sense to improving the lives of the patients that we're seeing.
One exciting thing that I'm looking forward to hearing about, but we've all been living it here in the IBD Center, is the joint clinic with we have a rheumatologist in the clinic. And I think it certainly made me a better carpenter. I used to be just a plumber. Now I'm a carpenter. I have to think about the joints a lot more than I used to. So Maya, what are some of the lessons that are going to be sort of discussed or explored, or how is this experience going to be presented during the course this Saturday?
So, we are one of the only IBD centers in the country to have this specialty clinic in the IBD center, which is the IBD DART clinic, which, as you said, is a combined rheumatology gastroenterology clinic with focus on IBD patients. And we're very lucky to have one of our own IBDologists and one of our own rheumatologists see patients together during the visit once a month for a whole session. And one of the interesting things that are, obviously coming out of the clinic is not only that the inflammatory disorders, rheumatology and inflammatory bowel disease are so similar, but also the extraintestinal manifestations that can be difficult to manage with one drug, and how we're managing them with different drugs, and just having the rheumatologist's opinion in real time has been quite revolutionary. And so one of the things that will be discussed this Saturday, I don't want to give away too much. I want to kind of tease the audience so that they make sure to tune in, but it's really lessons that have been coming out of the rheumatology IBD clinic. How do you manage a patient with very well-controlled luminal disease, but still active extraintestinal manifestations, for example? And there's a lot of overlap in the rheumatology and the inflammatory bowel disease medications, but yet there's nuances, and one medication might work better for extraintestinal manifestations, but not as well for a patient's particular type of IBD. And so those are the lessons that are coming out of the clinic that we're hoping to highlight this Saturday.
I'm really looking forward to that. And finally, Rob, we have a special guest speaker, Dr. David Rubin from the University of Chicago, a beloved colleague and really just a wonderful speaker. Could you tell us a little bit about what Dr. Rubin will be discussing?
So Dr. Rubin, we're honored to have him deliver our Lloyd Mayer Memorial Lecture this year, which is in honor of Lloyd Mayer, who had been Chief of Gastroenterology here at Mount Sinai in the past. And Dr. Rubin, who's a phenomenal speaker, will be speaking about positioning of therapies in inflammatory bowel disease. And he's really going to be examining, as we're starting to grow and increase the number of medicines that are approved, for the treatment of IBD, how we can start positioning these agents and how can we pick which one should be first, perhaps, when we're seeing a patient in the clinic, or second or third for both ulcerative colitis and Crohn's disease. So should be really a great lecture, and I'm really excited to hear his talk.
Well, I'm really looking forward to it. And Rob, I know you particularly have done an incredible job of organizing all of us faculty during this sort of still not quite in-person era. Hopefully next time we do it, it'll be in person. So I really want to commend those efforts, and I look forward to, very much look forward to the course this Saturday. And Maia, thank you also for joining. Looking forward to hearing you, and thank you both for being co-directors for this important course. The course is free, absolutely free. We will include a link for any of our viewers who are interested in watching part or all of it. It's a long day, so you have to really be interested in IBD to stay with it. But I promise you, the talks are going to be illuminating and informative. So this is Dr. James Marion thanking you once again for paying attention to our Facebook Live on tape via Zoom here from the Susan and Leonard Feinstein Inflammatory Bowel Disease Center at Mount Sinai Medical Center in New York City. Thank you, and I hope we see you this Saturday, and if not, you'll see us again next month. Thank you very much.